This bone here is known as the scapula, more commonly called the shoulder blade. It sits on the back of the thorax and moves in coordination with the movements of your arm. The scapula plays a very important role because it connects the upper limb to the trunk and allows the arm to move freely in many directions. In our upper limb series, the scapula comes right after the clavicle, which we discussed earlier. In this lesson, we'll turn you into a scapular expert by exploring its major parts, borders, and surfaces. Let's begin with a quick observation test. Are we currently viewing this bone from the front or the back? The correct answer is the posterior view, meaning we are looking at the back side of the scapula. As we continue, we will examine structures visible from both the posterior and anterior perspectives. Coracoid process. One of the first landmarks to discuss is the coracoid process. The coracoid process is a hook-like projection located on the anterior surface of the scapula. Its shape resembles a curved finger pointing forward and slightly outward. Interestingly, the name coracoid comes from Greek and means raven's beak. Functionally, this structure acts as an important attachment site for muscles. One of the muscles that attaches here is the pectoralis minor. This muscle originates from the 3rd to 5th ribs and inserts on the coracoid process. Its action pulls the scapula forward and downward, helping stabilize the shoulder during activities like pushing or reaching. Another muscle attaching here is the short head of the biceps brachii. The biceps actually has two heads. The short head originates from the coracoid process, while the long head arises from the supraglenoid tubercle inside the shoulder joint. Together they help bend the elbow and rotate the forearm, but the short head also contributes to anterior shoulder stability. Spine of the scapula and acromion. Moving back to the posterior surface, one of the most noticeable features is the spine of the scapula. This ridge runs across the posterior surface and continues laterally until it expands into a broad projection called the acromion. At the point where the spine curves to form the acromion, we identify a landmark called the acromial angle. The acromion forms the highest point of the shoulder and connects with the clavicle at the acromioclavicular joint, through a surface called the clavicular facet. Just below the spine along the lateral edge lies a small bump called the deltoid tubercle, which serves as a point where the deltoid muscle originates. Deltoid and trapezius muscles. If we add the surrounding muscles, the anatomy becomes even clearer. The deltoid muscle, which gives the shoulder its rounded appearance, originates from the clavicle, acromion, and the spine of the scapula. It inserts onto the deltoid tuberosity of the humerus and its main function is abduction of the arm, meaning lifting the arm away from the body. Another large muscle attached here is the trapezius. This superficial back muscle also connects to the acromion and spine of the scapula. It plays an important role in elevating, retracting, and rotating the scapula. Together, the trapezius and deltoid shape the contour of the shoulder. Acromioclavicular joint and coracoacromial ligament. When we view the scapula from the front, we can see how the acromion connects with the clavicle to form the acromioclavicular joint. This joint participates in movements such as shrugging, raising the arms, and rotating the shoulder. Another important structure in this region is the coracoacromial ligament. This ligament stretches between the coracoid process and the acromion, forming the coracoacromial arch. This arch acts as a protective roof above the head of the humerus, preventing it from moving too far upward and protecting the shoulder joint. Foci of the scapula. Looking again at the posterior surface, the spine of the scapula divides this area into two depressions. Above the spine is the supraspinous fossa, and below it is the infraspinous fossa. These spaces serve as attachment areas for muscles. The supraspinatus muscle occupies the supraspinous fossa. It is one of the 4 rotator cuff muscles and plays a role in initiating arm abduction, assisting the deltoid. Below that, the infraspinatus muscle lies within the infraspinous fossa. It also belongs to the rotator cuff group and is responsible for external rotation of the humerus. Together, the rotator cuff muscles stabilize the glenohumeral joint, holding the head of the humerus firmly against the glenoid cavity. Subscapular fossa. On the anterior surface of the scapula is another large depression called the subscapular fossa. This area houses the subscapularis muscle, which is actually the largest rotator cuff muscle. Its primary function is internal rotation of the humerus, and it also helps keep the head of the humerus securely positioned within the glenoid cavity. Damage or inflammation of this muscle can limit shoulder rotation and lead to joint instability. Glenoid cavity and neck of the scapula. Just medial to the glenoid cavity is a slightly narrowed region called the neck of the scapula. The glenoid cavity itself is a shallow, pear-shaped socket that articulates with the head of the humerus to form the glenohumeral joint, which is the main shoulder joint. This joint is the most mobile joint in the human body, allowing a wide range of movement. However, this mobility also makes it prone to dislocation. Above and below the glenoid cavity are two small but important landmarks. The supraglenoid tubercle sits above the cavity and provides the origin for the long head of the biceps brachii. Below the cavity is the infraglenoid tubercle, where the long head of the triceps brachii originates. This head of the triceps crosses the shoulder joint and contributes to elbow extension and shoulder stability. Sphenoglenoid notch. Another structure on the posterior side is the sphenoglenoid notch, located near the junction of the spine and the glenoid cavity. This notch allows passage of the suprascapular nerve and blood vessels as they travel toward the infraspinatus muscle. Borders and angles. Now let's examine the edges and angles of the scapula. The superior border contains the suprascapular notch, which is covered by the superior transverse scapular ligament. This ligament forms a small opening. Also attached to the superior border is the inferior belly of the omohyoid muscle, which helps depress the hyoid bone and serves as a useful surgical landmark in the neck. The superior angle marks the meeting point of the superior and medial borders. The medial border, also known as the vertebral border, runs parallel to the spine. The inferior angle is the lowest tip of the scapula and is easy to feel on the back. Finally, the lateral border extends upward toward the glenoid cavity. Muscle attachments along the borders. Several muscles attach along these borders. At the superior angle, the levator scapulae inserts and helps raise the scapula. Along the medial border, the rhomboid major and rhomboid minor attach. These muscles pull the scapula toward the spine and help rotate it. On the anterior surface of the medial border lies the attachment for the serratus anterior, which is responsible for protraction and upward rotation of the scapula. Weakness of this muscle can cause a condition called scapular winging. On the lateral border, we find the attachments of the teres major and teres minor muscles. The teres major assists with adduction and internal rotation, while the teres minor is part of the rotator cuff and contributes to external rotation and stabilization of the shoulder joint. Conclusion. And that brings us to the end of our overview of the scapula. We've explored its major landmarks, borders, surfaces, and muscle attachments, making it easier to understand how this bone supports the incredible mobility of the shoulder.